So my name is Dr. Were Andrew. I'm a plastic reconstructive and aesthetic surgeon based in Nairobi. I do practice in Kenyatta National Hospital, and I also do work at Da Vinci Medical Group, where we offer both reconstructive and cosmetic surgery services to our clients. Today we are partnered with Ponea Health to talk about plastic surgery in Kenya. As I mentioned earlier, plastic surgery is more than the cosmetic aspect. We also have the reconstructive, and we're doing a lot of good jobs in terms of taking care of cancer survivors, taking care of people with diabetic wounds. Now we are using stem cell therapy to be able to ensure that kids and teenagers who have sickle cell disease and wounds then are able to be healed because of that new technology that is being developed here in our country. So plastic surgery is a very wide kind of specialty, and we welcome you anytime to visit us so that you can be able to understand better and to get the kind of service that you need from us. There's an issue about stigma and plastic surgery, and I think we used to see it more in the past when we had very few plastic surgeons in the country. Right now, as we speak, we have more than 25 plastic surgeons, 20 who are based in Nairobi, who are able to provide the same service very safely. If you look at the data from US, we're having more than 21 million people doing plastic surgery services, procedures each and every year. And there's nothing wrong with you wanting to look good. And as I said, plastic surgery is more than the cosmetic aspect. If I give a very good example, we have ladies who have very high BMI. These ladies come and working together with other surgeons, we do for them sleeve gastrectomy. This is basically reducing the size of your stomach, or we do what is called a bypass surgery. We bypass your stomach so that you can have a feeling of fullness early. Once these ladies go for that particular surgery, then they remain with a lot of excess skin, which needs to be draped and looked at. And you see, as you are doing that, you'll find most of these women normally have issues with sugar control, diabetes, and by doing that surgery, then they're able to get healed. But the stigma that thinking that plastic surgery is vain, I can assure you it's not. In fact, more and more people are now accepting and actually coming to our clinic. That's the reason why I'm here, because if there's no plastic surgery by clients, then we'll not be able to do it. So but there's nothing wrong with you wanting to look good. There's nothing wrong with you wanting to remove a blemish from your face. There's nothing wrong with you wanting to have your body the way you want it to be. It should not be defined by someone else, but by you coming forward and saying, hey, Dr. I need to look this good. On issues about stigma and plastic surgery, I think we all need to accept that beauty should be defined by you, and everyone should feel comfortable in their skin and be able to look the way they want to. And if you look at most cases that you have done, it has actually helped in improving the self-esteem and improving even businesses for some of the ladies and even the men that you have done in our clinic. So you should not hold back because someone says that maybe going for plastic surgery procedure is vain. I can assure you it's not, because most of the time it's you who defines what you want to look when you stand in front of a mirror, and you should be able, if you can be able to pay for it, then you should be able to come to us and be able to reproduce that for you. There's always this myth again about the price of plastic surgery, that it's too expensive. I can tell you there are more than 100 procedures for the normal surgical procedures I do that are more expensive than plastic surgery. You can have a tummy tuck for as low as $250 to as high as $650. So it depends with where you go and do it, with whom you're doing it with, and also what effort you're going to put in it as a patient, because sometimes when you come and see us and you do undergo an exercise and a dieting regime before you come, then you find the work that you have to do on you is not a lot, and then that also lowers the price. Nowadays we're having options. We know there's a challenge, especially the cosmetic bit, in terms of it being covered by insurance. but we're having options where you can actually even come to our clinics and decide, let's have a save with you for the whole year, or let me have this procedure and then pay it in bits for a period of 6 months. And that is something that you have tried to implement in a clinic to demystify the issue of cost about plastic surgery, and also to make it more accessible to more women. And we are also seeing even more men. Actually, we are doing a ratio around 70 women to 30 for men in terms of the request for cosmetic plastic surgery. So you need to look the way you want, and if you desire to look like that, no one should be able to define that standard for you. Come to our clinic, see us, and we'll be able to give you what you want. Thank you for joining us for this episode. You can book my services through ponea.com, and I hope to see you at Da Vinci Clinic to give you what you want. Thank you.